Hi, I'm Dr. Kristopher Hamwi, a board-certified plastic surgeon at Florida Plastic Surgery in Sarasota, Florida. A common question I get is, am I a good candidate for a brachioplasty, also known as an arm lift? So we're here to give you information to help you make the best decisions for you. And when it comes to a brachioplasty, typically the best patients or good candidates are patients that have excess skin that sags, or they've got excess volume and their skin elasticity isn't adequate to remove that volume without creating additional looseness in the skin. So when we have patients, we evaluate them not only for the amount of hang they have, but also the elasticity of their skin. And we couple that with the amount of volume that they may want to have removed. And so those factors are ultimately what are discussed in the consultation to help determine if someone is a good candidate. Beyond that, we're also looking to make sure that the patient is healthy. This means being a non-smoker, making sure your medical conditions are well controlled. Also, we ask that patients are close to their ideal body weight. What we're looking for there is you don't want to have a patient that you do an arm lift on. You make something look perfect. It's all lifted just the way you want. And then if you lose an additional 30 pounds, the tissue actually becomes looser. So being close to your ideal body weight allows us to give you a long-lasting result that you're going to love, and to some extent, it also reduces the risks. Another important component is being comfortable with the associated incision. So a brachioplasty is sort of like a tummy tuck for your arms, and it has an associated incision that will eventually become a scar. Scars, once they're fully healed, it's quite variable. And so for patients, the result or the lift from the brachioplasty needs to be weighed against that resulting scar. And so when I'm having an early consultation with patients, I want to know what they know about brachioplasties, how much they've investigated this, and I want to make sure that that trade-off for the incision is that the patient finds the resulting scar from the brachioplasty reasonable.